Hi guys, thanks for letting me talk today about cramping. Cramp is a sudden involuntary muscle contraction or over-shortening. While generally temporary and non-damaging, it can cause significant pain and paralysis, especially in footballers. Onset is usually sudden and it resolves on its own over a period of minutes or hours. Cramps may occur in the skeletal muscle or in the smooth muscle. Skeletal muscle cramps may be caused by muscle fatigue or a lack of electrolytes, such as sodium, potassium, and magnesium. Cramps can also occur in the smooth muscle, but may be due to gastrointestinal problems or in women, menstruation. Treatment of cramps involves stretching, massage, and drinking plenty of fluids or liquids may be helpful in treating muscle cramps. Quinine, which was found in bananas and tonic water, was seen as a traditional treatment for cramping, but was only proven to be effective in 40% of cases. Whereas vitamin B complex and calcium may be more effective for cramps. Prevention of cramps involves adequate conditioning, so with your strength and conditioning coach at your football club, stretching, perhaps on your own or with your physio, hydration and electrolytes may also help, as massage maybe with your sports therapist at your club may help prevent cramp. The latest research now suggests that cramps may occur due to an altered reflex control mechanism, especially at the Golgi tendon organs, which may be more likely to cause the fatigue in the muscles. Risk factors for cramping includes athletes who have different thresholds for cramping. A prior history of cramping can also significantly cause more cramps, and a family history, and they've also linked a collagen gene that may be responsible. And cramping is more common in men than women due to men having more fast twitch fibers. Hi guys, John Rothery, Osteopath. Thanks for allowing me to chat today about cramps in footballers. Once they've had cramps, then massage is really helpful. But what I tend to do is what's called fascial release. We get the patient or the athlete to move as I treat. So what we're going to do is get him to bend his knee. And what we do is, and straighten your leg. And then to assess the hamstrings, we're looking at about 45 degrees there, which is chronically tight. So what we do is bend the knee for me. I put a bit of lotion on here. I'm going to use the back of our metacarpal joints here. And all I'm going to get Matthew to do is keep this still and like a hinge. So as he lengthens the hamstrings, we're going to work through the fascia there. So the tissue, the connective tissue. So we're just working through. You can see there from the video we did last time, you've got obviously semimembranosus hamstring here and bicep femoris. So we can work in the middle here. So just nice and slowly with fascia release, we just get him to straighten the leg and drop it down. And we're just working through the hamstring. So you get the patient to do a bit of movement, and we're also trying to work through the tissue. You've got the ITB down the side here and also vastus lateralis. So we're just working through nice and steadily as many times as it takes to increase that length of the hamstrings, which will really help with cramping. What we can do is an MET or a PNF stretch. A PNF stretch is what we did last time. I'll just show you again. We've got a couple of ways of doing it. If you just straighten your leg, and all I'm going to get him to do is push away. So push away 10%. Keep it straight, Matt. So push away 10%. I resist it, and it's a proprioneural facilitation stretch. Relax the muscle and breathe in and take it towards you. So that'll increase the length. Again, we go back to what we're doing. We can try and orientate the leg in different angles. So straighten the leg. So for bicep femoris, we can actually adduct the leg and obviously try and internal rotate the tibia. So straighten the leg. So we're working more bicep femoris, which is one of the outside of the hamstrings. If it's inside, we can rest the leg on the inside and using the inside hand, just try and straighten the leg. So we're working the hamstrings, which are quite tight here. And again, nice and slow, just working our way through. We can do the last technique. It's called a pin and stretch technique. So this hamstring here, the semimembranosus tendinosus, we can fix, and we can fix with a double thumb and pin it and then straighten the leg. So we can work through the fascia and just lengthen it. Good. Drop it down, work our way towards the origin insertion again. So the origin is the ischial tuberosity here, and the insertion is the pes antonine, which we talked about with the bursa. Straighten the leg. Good. If we want to work on the outside, the bicep femoris, we can change our location again. Up we go. Good. We can do what's called another PRI stretch, which if you push down towards my shoulder, so we fire up the hamstrings. It gives us like a refractory period to lengthen the hamstrings and relax now. And then we go back to straightening. And you can see already his hamstrings have started to lengthen, which will help prevent cramp in the future. Okay, thank you.